tell me what your name is. Tell me what your educational background is, and tell me some things that you. Well, let's start there.
I'm Tegan Hunter. I'm a resident physician in obstetrics and gynecology at the University of Miami. I grew up in Normal, Illinois, went through the ISU lab school, so MedCap and U-High, and then went off to MIT for my undergraduate degree where I studied biology. And then after that, I went to the University of Miami for med school, and now I'm doing my residency at the University of Miami as well.
And when does when did you graduate from med school, and when does the residency start?
Residency started a couple days ago, and I graduated from med school in May.
Right, so it's all quite new in terms of that.
Yeah.
So Tegan, when was the last time you took a chemistry class?
The last time I took a chemistry class at all would have been my first year of medical school. So that would have been 3 years ago. And the last time I took general chemistry would have been my first year at MIT, which would have been 8 years ago.
Right. So tell me some of the things that you and either are currently using from general chemistry or anticipate using from general chemistry over the next few weeks and months.
So we use general chemistry in a lot of different ways. We use a lot of sort of the math skills that you develop in general chemistry to calculate dosages for various drugs. We use the half-life of drugs all the time to figure out sort of the frequency of dosing and the polarity of drugs as well, because most drugs are cleared through the kidneys. But some drugs will actually, based on the polarity of the drug itself, bind to proteins, and those are excreted through the liver. And depending on whether or not a patient has a kidney disease or a liver disease, you might need to change the dosing to account for that. And that's something that we do every single day with the patients that we see. We also use a modified version of the Henderson-Hasselbalch equation to look at acid and base disturbances in our patients. Frequently, young teenagers who are new diabetics will come in to the ED and they'll be completely mentally altered. They will be confused, weak, don't know what's going on, and that's because the sugar went too high because they don't know they have diabetes and they're not producing insulin. Their sugar level goes up. And then it messes up with all the other electrolytes in the body. And when figuring out sort of what needs to be corrected and how much, we use a modified version of the Henderson-Hasselbalch equation.
That's awesome.
In terms of research, we don't necessarily use any of the sort of formal math that's treated, but a lot of the skills that I used in general chemistry or just for problem solving, working through the equations, you use as well when you're evaluating patient records when I'm doing my research.
So that sounds like a ringing endorsement for doing well in the course.
Yeah. If you do well, if you do want to go to medical schools look at your gen chem and biochem grades to know whether or not you can keep up, learn the material, and do the math. It's considered a strong indicator for your problem solving ability.
Right. What else what other general advice do you have for people? For studying chemistry, studying in university, for being successful, for getting into and getting through medical school. Got any advice like that?
I think, especially if you're doing a degree in the sciences, lots of learning happens in the classroom, but a lot of the learning happens outside the classroom. Actually, as a high school student, I did research at ISU for a couple of years, and I think that was really helpful for getting into college. But it also set me up for doing really well at research in college and now as a doctor. So if you can try and reach out to a professor at ISU and see if you can do some research, that would be a great experience to use what you're learning in the classroom to in the real world, and you'll get some really good hands-on skills.
Okay, get involved in research. Awesome, that's exactly what I wanted to know. Okay, thanks, Tegan. I really appreciate you taking the time to talk to me and for letting me record this and share it with my students.
Okay. Bye.
Okay.
Nice to
Bye.
see you.
Bye.